think if people keep in mind this aspect of nutrition, like nourishing ourselves for what we need today and what we need tomorrow, it's not to say that we're storing those nutrients, but we're doing the kind of cellular repair and like daily housekeeping and maintenance that we need for long-term health. And so then, keeping that in mind, you probably usually want to get more nutrients than a recommended daily intake, or at the very least, make sure you're not short on anything. If your B12 levels are low, and they don't even have to be super low, but in the bottom third, that is a nutrient that is really important for the brain and nervous system and neurological function. And if your B12 levels are low, some of the signs of that can be forgetfulness and clumsiness.
Welcome everybody to the Healthy Habit Podcast, episode number 81 in our part 2 of 2 discussion with Dr. Kate Rhéaume in our Healthy Aging series. And we'll even connect this to the immune system today because aging, inflammation, and immunity are all connected. So let's welcome back Dr. Kate to the program. She's an author and naturopathic doctor, graduate and former faculty member of the Canadian College of Naturopathic Medicine. Dr. Kate lectures internationally on many topics related to health and wellness, and she's a frequent guest on radio and television across North America. She's the author of the best-selling book, Vitamin K2 and the Calcium Paradox, which we covered in part 1 in episode 80, so I suggest you go back and listen to that one, as well as our previous interviews with Dr. Kate back in episodes, looks like 50 or 25 and 26. So Dr. Kate, welcome back to part 2 of 2 today.
Hey, Dr. Dan. Thanks. Great to be back.
It's good to always talk to a fellow Canadian, so that's awesome. And I actually almost attended CCNM as well. Last minute I chose SCNM, so Dr. Kate's a colleague of ours here. We're both naturopathic doctors, so it's amazing to talk to a fellow naturopath. So tell us a little bit. We're going to dive into a couple products that we have on the menu today, but before we start there, people are always wanting to know how they can build up their immune system, because when this episode airs, it's going to be well into the winter here. So how does that connect? Inflammation, aging, and the immune system.
It definitely connects. We know that there are a number of changes that happen in the body over time, 40 plus, 50 plus, and it seems to progress, with the decades, that can potentially impact the immune system in ways that may leave us more vulnerable to infection, potentially, or change the way our immune system responds to things. As we were, touched on in the first part, first half of this episode, you could say is the inflammation component, which when we're younger tends to turn on and off as needed. And as we get older, it can kind of turn on and stay on a little bit longer than needed. But in terms of like our immune system, when it comes to, say, wintertime illnesses, which we know tend to be caused by viruses out in the atmosphere, then this also can change and affect the way we respond to things or how easily we get sick. But that's not to say there's nothing we can do about it. It just means that it becomes more important as time goes on and as we age to take the steps that do make a difference and give our bodies the nutrients to help our immune system, do its job better.
Amazing. In the previous episode, episode 80, we talked about theracurmin, the number one absorbed form, the most bioavailable form of curcumin that you can find, as well as RX omega-3, which comes from the anchovy, sardines, and mackerel. And so that's going to be one key piece of lowering that inflammation response and that inflammaging that you referred to. But let's bring in the idea of actual vitamins and minerals. So that covers the omega-3 fatty acid side, the herbal side with the curcumin / turmeric. Now, what role do vitamins and minerals play before we bring in B12 and the whole Earth and Sea Multi? But how important is it to get your vitamin mineral bases covered for that aging process?
It's so important. And I think that when you see recommended daily intakes of nutrients, that's based on usually the bare minimum that we need to avoid deficiency today. But it doesn't necessarily take into account that the body is wise, the body's really smart. And if you only have a limited amount of nutrients, the body will send those nutrients to the most immediate needs, whatever you need for right now. Maybe that's fight or flight hormones or whatever you're dealing with on a daily basis. And that may be at the expense of long-term health needs. So the kind of cellular repair that keeps you in better shape down the road. And so I think if people keep in mind this aspect of nutrition, like nourishing ourselves for what we need today and what we need tomorrow, it's not to say that we're storing those nutrients, but we're doing the kind of cellular repair and like daily housekeeping and maintenance that we need for long-term health. And so then, keeping that in mind, you probably usually want to get more nutrients than a recommended daily intake, or at the very least, make sure you're not short on anything.
Right, and then you actually wrote a book on this of getting too much of certain nutrients like calcium, where that can happen if you're just taking standalone calcium or eating even tons of dairy all the time, which gives you a highly concentrated form of calcium from food, plus taking calcium on top of that in supplements. Imagine the effect that that's going to have on the arteries. So it's important to have a properly balanced form of a multivitamin like the Whole Earth and Sea formula, which I'm pulling up right here through wholeearthsea.com, which is kind of a sister company to Natural Factors. And out of all multivitamins I've ever taken through the men's lines, this is definitely the most common one that I've used over the last 2, 3, 4 years. So tell us about this form of a multivitamin. We have both a woman's, we even have a 55 plus formula for both men and women. So tell us a little bit about this Whole Earth and Sea line.
Yeah, there's lots going on here. Four different formulas. Well, five really. There's a women's 50 plus, men's 50 plus, as well as a prenatal. And they are made in a base of whole foods. The kind of foods that tend to make it to the list of superfoods. Many of these foods are grown on Factors farms in the Okanagan, which is 1,000 acres of organic farmland in the interior of British Columbia. And that whole food base will complement all of the vitamins and minerals you expect to see in a multivitamin. You obviously want to hit all of the essential nutrients, many of which are food extracted whenever that makes sense. Things like selenium from sprouted garlic, iodine from kelp, vitamin C from amla, which is Indian gooseberry, and other examples. And then there are certain nutrients that offer a little bit more than a standard multi in, for example, the Bs. So the form of B vitamins that you'll find in here are what are called coenzyme or activated. When we take B vitamins in through standard forms of supplements or our food, the body needs to convert them in the liver through activated forms. You can do that using enzymes and then put those coenzyme, or what you could say is pre-activated Bs, and that's what you'll find in these multis, which is not that common for a multivitamin. So that's just kind of very broad strokes of these formulas and what makes them different from standard multis.
And I pulled up the men's version here, and again, there's a 50 plus for both men and women, and then just a standard men's and women's, and then as well as a prenatal. And if you caught that before I switched screens here, there was also a bone structure version. So what's going to be the biggest difference then in the men's and women's formulas? Are we just going to have more things like lycopene down here, boron for the prostate, and things like this?
Definitely the men's formulas have exactly right. So more nutrients for prostate health, and the men's 50 plus formula has even more of that for prostate health and prostate support. The men's formulas are also iron free versus the woman's formula will have iron in it. Now the women's 50 plus formula will also be iron free because typically men as well as women who are past menopause and aren't losing iron on a regular basis, like a monthly basis, don't need usually an iron supplement unless you have a blood test that indicates you need that. So that's another difference that you'll find that sort of customizes and tailors these specific formulas.
And actually, you can see in these formulas, you have that theracurmin, which we discussed in episode 80. which was a perfect segue because you introduced it for us, and now we can see that it's also part of these multivitamin, multimineral formulas through whole earth and sea. And tell us a little bit about these polyphenols. When you hear that word, what do you think of? What are they so important for? You know, most people don't eat enough of these foods right here that I'm highlighting. If you're listening on audio, that's going to be like the dark purple types of fruits and vegetables, purple, red, cranberries, blueberries, pomegranates, things of that nature. Tell us about polyphenols.
Yes. So we know we're often told to eat colorful fruits and vegetables. And one of the reasons why those foods look so beautiful and are so appealing to us is because those bright colors, like the blues and the reds, they signal to us good nutrition. Specifically, when it comes to polyphenols, this is a large group of naturally occurring phytonutrients, most of which, I mean, they have all kinds of different benefits, but most of which you can typically rely on them being good antioxidants. So it's interesting because we have a recommended daily intake of vitamins and minerals. There is no recommended daily intake of antioxidants, but they are so beneficial for us, do so many things. The more the merrier when it comes to antioxidants. So yes, when you look at a combination like this that has those, the berries, the blueberry, pomegranate, for example, all of those provide these what are called polyphenol type antioxidants.
So we do have vitamin B12 as methylcobalamin in this formula at 2 tablets giving you 400 micrograms. So when would someone know that that's enough, or maybe they need to take the standalone B12 as well? How would we approach that?
Mm-hmm. Great question, because this is such an important nutrient at any stage of life, but for the aging process as well. And it is worthwhile getting a test done. A vitamin B12 test is something that can be added on to your regular annual blood work, or see your naturopathic doctor, to get that done if necessary, because if your B12 levels are low, and they don't even have to be super low, but in the bottom third, that is a nutrient that is really important for the brain and nervous system and neurological function. And if your B12 levels are low, some of the signs of that can be forgetfulness and clumsiness. So that's how it affects the nervous system. And many people will say, oh, the person's just aging. Of course, you're going to get a little bit forgetful, but maybe not. Of course, we know that can happen with the aging process, or maybe it's low B12. That really does make an impact. And we absorb less B12 as we age. People may be eating smaller amounts of food that contain B12, like meat typically is the best source of it. And so, in fact, B12 deficiency with age does become more common.
Right, as people age, the stomach acid gets weaker and weaker as well, so it's harder to pull the B12 out of the meat if they are eating meat or whatever, any food you're eating. It's hard to extract the vitamins and minerals out of those foods. So I pulled up here the methylcobalamin 1000 microgram B12, a quick dissolve version. So these are chewable tablets, is that correct?
Even they just dissolve right on the tongue. You can chew them, or you can let them dissolve right under the tongue. Sublingual form typically will be absorbed, straight through the under the tongue into the bloodstream.
Right. And if you recall in the multivitamin, we had 400 micrograms per 2 tablets. So this is a much more concentrated source. Again, as Dr. Kate said, it's wise to get a B12 blood test. That's one type of anemia that people deal with is B12 deficiency anemia, which becomes more common as people age. So how does B12 then connect with that aging process, inflammation? Since we're on that topic of healthy aging, how important is it to get that B12 through your 50s, 60s, 70s, and beyond?
Well, again, this goes back to that concept of, if you don't have enough of it, the body will use whatever it needs for its short-term use, and maybe that's at the expense of long-term health of your neurological system, for example, because we know that that is something that can be affected by that. And so, the multis, 400 milligrams is quite a good dose in the multis, but for somebody who's already low, who's not absorbing it, who's on a vegetarian diet, maybe has cut back on meat for financial reasons. We know that meat has gone up so much in price, and it is one of the best sources of vitamin B12. Liver actually is the top source of vitamin B12, and very few people are eating that. Nobody's ever excited to hear me say that, but if you can get in a weekly serving of liver, you might be okay in the B12 department. So the point is, people are eating less B12 rich foods, absorbing less of it, and so this really can be important as part of the aging process.
Right, and that's where individuality matters, working with your healthcare practitioner, getting your blood tested. We're never giving medical advice here on the show. We're just presenting the information to you and showing you what's out there as a possibility. This is the 1,000 microgram version. We also have a 5,000 and a 10,000 microgram version of the methylcobalamin B12. How is this going to be different from, let's say, cyanocobalamin, hydroxycobalamin, methyl? There's even adenosine cobalamin. Which one do we need?
Mm-hmm. Yes, there are different forms. The most common form that you'll find on the market for a long time was this cyanocobalamin. That is a synthetic form of vitamin B12. The methylcobalamin is a natural form. So for everyday supplementation, I definitely tend to prefer and choose and recommend this methyl form because it's you could say biocompatible. It's identical what we would normally have in our body. So that's something to look for when you're shopping for a B12 supplement.
Amazing. And when people think of B12, Dr. Kate, they just think of energy. That's kind of the main thing they think it's used for. But you need it to maintain nerve function, like you mentioned. We can't produce red blood cells without it as well. And even to metabolize other nutrients. So it does so many different things in the body. What would be a good recap then on vitamin B12 and the whole Earth and Sea multivitamins here? Good take home.
Mm-hmm. Yeah, to keep in mind that as we age, B12 deficiency becomes more common, and it's something that it can impact, mood, nervous system function, and memory. And so, keep that in mind for people who feel like they're aging or their memory is going, to get that checked. And just a well-formulated multivitamin and mineral that includes things like the polyphenols, the antioxidants. It goes a bit above and beyond to make sure you're not having a shortfall in any individual nutrient, whether it's an essential nutrient like a vitamin and mineral, or things like the antioxidants.
Perfect. And even though we are talking about healthy aging, it's so important to talk about setting the stage for life in general. How important is a prenatal?
Mm-hmm. Oh, it's absolutely essential. It can really be challenging to get in optimal amounts of nutrition when you're expecting. And when it comes to prenatals, there can be a wide range. As anybody who's ever been pregnant, tried different ones, knows which ones will sit well. That often has to do with either the form of iron that's in the prenatal, sometimes the Bs, whether or not they sit well. So it's good to try different ones, but particularly, I really like the form of iron in the Whole Earth and Sea women's prenatal. Find that it's very well tolerated, gentle on the stomach, and generally good feedback.
Right. And the evidence is clear that prenatals get the job done. They're important. They help prevent birth defects and many other issues that can happen with birth all throughout breastfeeding and that whole process to set the child up for a healthy life, where you want to set the stage. You want to start off on the right foot there for life in general. So, very important discussion, episode 81 with Dr. Kate Rhéaume here on the Healthy Habit Podcast. And so far in this two-part interview, we've covered theracumin, the most bioavailable form of curcumin, RX omega-3. We just introduced the Whole Earth and Sea multis, vitamin B12. And let's finish off here on my favorite note, on total body collagen. I've been using this pretty much every day for the last 2-3 years. I think collagen is a necessary nutrient for balancing out all the methionine we get in the diet from just typical animal products. Most people don't get things like glycine anymore, proline, hydroxyproline, glutamic acid. So give us a little intro then into total body collagen. Why should someone consider supplementing with collagen?
So you're actually 85, Dr. Dayan, but you've been taking this total body collagen and looking great. Yeah. 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 So this is, when we talk about the aging process, so much of what we perceive as the aging process, of course, is appearance, but joint health is part of it too. And the fact is that from our 20s onwards, we lose about 1% of our collagen per year. You don't notice that change at first, but by our mid 30s, we'll start to see things like fine lines, and that reflects sort of a net loss of collagen because our skin's 75% collagen. And when it starts to be lost, then you'll start to see fine lines and wrinkles forming. And the concern is more than just skin deep, because the extent to which we're losing it outside where we can see it, it's also being lost from the inside, places like joints in particular, but everywhere. I mean, collagen is throughout our body, and it can make up the structure of bones and tendons and joints and blood vessels and everything. And so that is something that is part of what we perceive as the aging process, is this loss of collagen. And there are ways to get it back. I mean, there's ways to protect our collagen loss to begin with, getting in adequate amounts of nutrients like vitamin C, we know is critical for making collagen. But particularly, I think in the last few years, it's been really exciting, the research on collagen supplements. You mentioned the total body collagen. This is made with Verisol. So this is a form of collagen that's clinically proven. So for example, one of the clinical trials shows improvements in deep wrinkles as well as fine lines. The studies looked at around the eyes within 28 days. And that just reflects, being able to replenish the body's collagen, or it's actually helps to encourage the body to make more collagen. And the results that you can see, as well as that also will have an effect on what's happening inside the body where you can't see.
Amazing. You mentioned the total body collagen. Well, I introduced that one, but there's different versions of it. We have a pomegranate, orange, and even an unflavored powder, plus the marine version of it, which has the hyaluronic acid, the L-glutamine biotin added in there. So what's going to be unique then about total body collagen as a collagen supplement compared to different ones that might be on the shelf that people are considering?
Mm-hmm. There's a few important things to be aware of, when you're shopping for a collagen product, and that makes this particular formula stand out. First of all, the clinically proven form of collagen peptides that are in there, that one of the studies I mentioned, it says right on the label, 28 days to reduce deep wrinkles. As well as a few of the key added ingredients. So there's a number of added ingredients in the formula, like the hyaluronic acid that helps with skin smoothing and hydration, which is really nice. But specifically, this has added tryptophan. And we know that collagen in its natural state has all of the amino acids except tryptophan, or very little tryptophan in it naturally. And so collagen isn't technically a complete protein. That in itself wouldn't be a big deal because we're not using this as a protein supplement. However, studies have shown that if you supplement with collagen that doesn't have extra tryptophan in it, you can end up with an imbalance in tryptophan. And that's problematic because that can affect mood, cognitive function, sleep potentially. There's a few studies where they have looked at this. And so this is why I really encourage people shopping for collagen supplements to look for one with added tryptophan, and the total body collagen does have that.
Right, you're getting even gut support through collagen because of the glutamine component in here. One scoop gives you half a gram. 2 scoops, you're getting 1 full gram of glutamine in there. And, as a lot of people, they're aging, they get a lot of gut inflammation. And then that can lead to that B12 deficiency that we mentioned. If they're not connected, everything we're discussing here. I love how on the side here you can see there's an amino acid profile that's provided where you can see how much glycine you're getting per 1 scoop and 2 scoops. 2,600 versus and 5,200 in 2 scoops. And you can see how low the methionine content is, 106 and 213, where people that just eat only red meat and bacon and sausages and chicken and stuff like that, they're getting tons of the methionine and barely any of that glutamic acid glycine. So I think that's such a critical part of collagen. Did you want to add anything to that?
No, I like that. I mean, it's, you're an amino acid keener, obviously. And I know this is getting, for some people, maybe getting into the weeds, but it really is important because you can ultimately become, have an imbalance with your amino acids. and taking a collagen product if it's not balanced. And so that is an important thing to be aware. It's a little technical, but it is important to be aware of.
That's us getting into the nerd zone here in the in our conversation.
Which I'm sure your listeners love.
Whenever I do prescribe collagen in the clinic here, I do explain that just so they really understand kind of the reason why we're doing this. So it matters. And like Dr. Kate mentioned, hyaluronic acid, these are all, and collagen in general, the most abundant protein in the human body. They're lost. We can't produce it as well as we age, right? That's a key take home on collagen. Would you agree with that?
Yes, exactly. That's what's happening. And so this is a way to help replenish it, help step up the body's natural production, as well as provide the building blocks for that collagen production. And it is one that, makes a difference that you can see. But we also know that there's other studies to show that it's making difference on the inside where you can't see.
Right, and as you mentioned, not many collagen products have that on the label, where 28 days, about a month or less, to actually begin to noticeably reduce deep wrinkles. Nothing's guaranteed, of course. You got to be consistent, just like anything else. And that's a perfect place to end it then in our part two aging discussion here with Dr. Kate. What do you want to leave our listeners with here, Dr. Kate? Thanks for tuning in all the way from just outside of Toronto, more closer to Hamilton, Ontario. Thanks for coming on. What's a good take home for us here?
To know that we're not necessarily at the mercy of the aging process. There's just so much that we can do nutritionally and with lifestyle to age as well as possible, and probably much better than we might have thought.
Amazing. I look forward to our next discussion, Dr. Kate. Thank you for coming on.
You're welcome. It's been a pleasure. Take care.